Strategy Committee regular meeting. To begin, I'd like to remind everybody to please say who they are before they speak. This is Grant Ritter. I'm standing in for Steve Hernandez for this meeting. If we could we start with a roll call attendance? We're going to have a lot of votes here at the beginning, I'm afraid.
Steve Hernandez, okay, not here. Grant Ritter.
Here.
Paul Philpott. Paul Lombardo.
Here.
Thank you. And CC Woods.
Here.
Thank you.
Okay, great. Could I now ask for the members of the AHCT staff to introduce themselves so we know who's
Good
on?
afternoon, Good afternoon, James Michelle, Access Health Connecticut.
Hi, this is Tony Crow from Access Health Connecticut.
Hi, good afternoon. This is Daryl Jones, Director of Finance for Access Health Connecticut.
Good afternoon, Susan Richby, Director of Legal and Governmental Affairs for Access Health Connecticut.
Good afternoon, Caroline Lee Ruette, Director of Marketing, Access Health Connecticut.
Good afternoon, John Carbone, Director of Shop and Product Development, Access Health Connecticut.
Good afternoon, Glenn Jurgen, Director of Human Resources, Access Health Connecticut.
Hello, everyone. Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Is that it? Anyone else? Okay. So we're going to take some votes here. I'm afraid the first thing we need to do is to have a vote to amend the agenda to include a vote for a presiding officer for the meeting. So could we have a roll call for that?
Is there a motion, Dr. Ritter?
Oh, I'm sorry. We need a motion. Okay.
To appoint a specific person for that role.
We need a motion apparently to.
Yeah, the first one is to amend the agenda.
I'm sorry,
exactly.
to amend the agenda.
Sorry,
that's correct. Sorry about that.
I didn't know whether we needed a motion for the amendment. Okay, so do I have a motion to amend the agenda?
So move, CC.
Thank you. Second?
Paul.
Better be Paul.
See.
Can I do it?
Lombardo?
Where'd he go? Uh-oh.
Susan, can I do this?
That's a funky question. I guess you called for the motion. I guess you can. I don't know what happened to, yeah, I'm looking to see if Paul, he's on, but maybe he's on mute.
I'm sorry, I was on mute.
Sorry.
Oh, okay. All right.
Thank you.
Can we get a second on the motion to amend the agenda?
The second.
Thank you. All right.
Thank you.
Can we have a roll call?
Sure. Steve Hernandez, Grant Ritter,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
and CC Woods.
Yes.
Thank you.
Okay. Having amended the agenda, can I have a motion to appoint Grant Ritter to be the presiding officer in the absence of the chair? Steve Hernandez.
So move, CC Woods.
Thank you.
Second, Paul Lombardo.
Thank you. Okay. Can we have a vote on that?
Steve Hernandez, Grant Ritter,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
and CC Woods.
Yes.
Thank you.
Okay. So there's no public comment, so we'll move on to the next agenda meeting, which is to could I have a motion to adopt the minutes from the June 9th Strategy Committee meeting.
Paul Lombardo moves.
Oops.
Oops. Second?
Second, CC.
Thank you. All right. Can we have a roll call vote on that?
Steve Hernandez, Grant Ritter,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
and CC Woods.
Yes.
Thank you.
Okay, now you have to help me out here a little bit. The next agenda item is the mission and vision status update. Is somebody going to give that first and then we vote on it? Who's in charge of that?
Yes, Caroline Lee Ruette, who I think is right there, will be giving the status update.
Yes, I'm happy to give that update, and then it's my understanding that we'll take a vote on adopting the new mission and vision. Is that correct, Martin?
That is correct.
Excellent. Okay, we can move forward to the mission slide. Just as a reminder, my name is Caroline Lee Ruette. I'm the Director of Marketing here at Access Health, and we've been working with this committee for the last couple of months, really, to make some big changes to our mission, our vision, and our guiding principles. The last time we had a discussion, there was a lively discussion about the definition of affordable. So we're still working through that for our guiding principles. But our mission and vision, we gained some consensus the last time we spoke on some revisions. And so we just wanted to review that today and hopefully take a vote so that we can bring it to the full board. So as a reminder, with our mission, it's what the company is right now, today. And so our suggested revision is to decrease the number of uninsured residents, improve the quality of healthcare, and reduce health disparities through an innovative, competitive marketplace that empowers consumers to choose the health coverage that give them the best value. Okay, and we can move on to the vision. Again, our suggested revision, after lots of great conversation, is to provide Connecticut residents with access to the most equitable, simple, and affordable health insurance products to foster healthier communities. It's a little bit of a mouthful, but some really great revisions there. And this vision statement is what we want to be in the future.
Okay.
Any
Thank you.
questions, comments here before we move forward?
Okay, thank you. I'd like to hear a motion that the committee adopt this in order to be able to take it to the full board.
So move, CC, and
Thank
thank you
you.
for the efforts, yes.
And second by Paul
Thank you.
Lombardo.
All right. Marcin, could we have a roll call vote?
Steve Hernandez, Brian Ritter,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
and CC Woods.
Yes.
Thank you.
Okay. Next, I guess, is chance to have a update on the open enrollment readiness plan. For year 10 already, CC, 10 years.
Thank you, everyone. Hi, my name is Marlo Pierre Lewis. Can everyone hear and see me? Just want to make sure before I continue. Awesome. Thank you for that acknowledgement. So as I stated before, my name is Marlo Pierre Lewis, and I'm the Associate Director of the Project Management Office at Access Health Connecticut, and I'll be presenting the 2023 open enrollment updates to the Strategy Committee. Thank you, Martin. The 2023 open enrollment period, also known as our OE10, is scheduled between November 1st, 2022 and January 15, 2023, which aligns with the federally facilitated marketplace open enrollment. And during open enrollment, our Connecticut residents will be able to enroll into a health and dental health coverage for the 2023 plan year. Around this time, Access Health CT Connecticut approximately gains 15% of new enrollment and then retain 85% of our consumers through auto renewal and active renewal. Our focus for this OE10 will be to provide market clarity on consumer impact to the 2023 pricing. There's nearly a 20% premium rate increase that may cause confusion to some of our consumers who receive the premium tax credit. So we want to make sure we message that the premium tax credit ensures that no one will pay more than 8.5% of their income towards the premium for a silver plan. We'll also continue to promote financial help through the Inflation Reduction Act. And the IRA it will allow individuals over the 400 FPL poverty line to continue receiving the tax credit. And we'll also continue acquisition effort for the Covered Connecticut program. This will be the first open enrollment where we allow all adults to qualify for it. Last open enrollment. As you guys remember, it was just for the parent and caretaker. And then we'll also focus on retention and transition of our existing dental enrollees into the streamline application. And then this open enrollment will be the first one where we fully integrated our dental coverage into our application process. And I'll speak a little bit more about the benefits to our dental integration later on. And then we'll continue to prepare for the impending end of the public health emergency. Again, I'll speak a little bit more to that, but I do want to just keep in mind that public health emergency, there's currently 400,000 consumers who has this extension. So the pool of consumers who are eligible for QHP will be impacted, and then that will result in delayed QHP enrollment post our open enrollment period once we start the unwinding process. But we are actively working with DSS right now on this unwinding plan. So when the time does come, it won't be a big impact. So this slide, I will go over the 2023 timeline. So for the month of September, our focus will be on the call center, CAC, and broker training, and also completing our system releases before OE, so that will be our last system update, and then also the final rate filing and the SID decision to be made public. In October, our focus will be in the 2023 plan renewal notice. We'll begin that communication when the window shopping period will be enabled for both the medical and the dental plans. And then also we'll make sure that our CAC and brokers, their users are activated into our system. And then any final training for the call center, that will also be our focus too. I do want to point out on this slide, the icons that have the envelope next to them, that is where we're going to highlight the events that require major communications to our customers. So we want to make sure they're being communicated and those are coming across clearly. And then also in October, as I mentioned, that's where we start our projection activities. And then in November, we finish with actually renewing the consumers into their 2023 plan through a crosswalk. This is where we gain 80% of our retention with those projection and finals activities. And then I'll move on to November. So November really just begins our open enrollment, and we'll continue with our open enrollment marketing campaign. So that's where we focus on retention and the acquisition. And then, as I stated before, at the end of November, that's when we'll do our final renewal into the 2023 plans. And then for December, we'll start the final renewal campaign. And then we will make sure we remind consumers the final date for the 1/1 effective date will be on December 15th. And then between December 15th and December 31st, our consumers will start receiving their notices from the carriers. And then in January, our focus will be around OE ending on January 15th. And then our existing legacy portal for dental, that will become decommissioned around the January timeframe. And then we anticipate to get a CMS PHE extension decision. Right now, we've been extended to October. We anticipate we'll get another extension to January 2023. If the 60 days notice to let us know that we would be unwind at the end of January, if that date is passed, then we're looking at January 15 for another extension, for another 90-day extension. So that is an activity we're on the lookout for in January. And then between January 15 to February, consumers will be expecting their invoices for their 2/1 effective date. So for open enrollment, there are some challenges that we see year over year. So on the left-hand side, that's what it's focused on, just our usual normal challenges. And then on the right-hand side, these are challenges that we want to bring to your attention specifically for the 2023 period. So one thing that we know is the short enrollment window this year, we'll see a little bit of impact because we are extending it till January 15th. However, it's still a short time frame where we're processing majority of our business. And then another challenge that we're aware of is the 2022 to 2023 premium changes. So Wakely will be conducting a impact analysis, and that will be shared with the board sometime in October. And then there's also consumer plan selection changes. So for this year, there's 2 new Anthem plans, and then there's 4 plans that will be discontinued. So that's 1 Anthem and 3 Connecticut plan that will be discontinued. And then Chi-Chi's also entering our dental market. So what this means, for the discontinued members, so there's approximately 11,500 members that we would have to figure out next step for them. So out of those members, so there's 8,200 members that we know for sure cannot be crosswalked into the 2023 plans. So our next step is to inform those consumers due in the projection letter that they would have to come in and actively renew for their 2023 plan. The rest will be able to map onto a plan that's in the similar richness as their 2022 plan. So those 8,000, again, they'll get their letters, and then we'll also make sure they're part of our retention strategy to make sure they know, up until the end of open enrollment, they have to actively do their renewal and not through the auto renewal process. And then one more challenge that we see year over year is just healthcare complexity with new laws and misinterpretation from our consumers. We want to make sure we're being proactive. And then this is why our marketing team really conducts the focus group, just to make sure that our messaging is cognizant of potential consumer confusion. So we're being succinct and clear when we send out our messaging. Now I'll switch to the 2023 challenges that we anticipate for this year. So there's the changing economy and inflationary pressure. We are happy that the IRA was passed. This does ensure that Connecticut residents will continue to have their premium tax credit up until 2025 plan year. But despite this increase, there is the inflation pressure where household may have to make the decision between, the necessity or foregoing health insurance. So we are aware that some of our consumers may, decide to not go for health insurance because they have to consider those necessity items that are experiencing the inflation right now. In addition, there's about 17% of our consumers that either decline to receive health assistance or they're ineligible for the tax credit. So those consumers will continue to still see the impact of inflation because they're not being insulated with the tax credit. So we are aware, those are some of the economic challenges that's going to be coming down for this population. And then another thing that we're closely watching this year is the transition of our technology. So for the past 9 years, we've been using one vendor that manages our application, our eligibility rules. But this year, we would be going to a new vendor. This will be a slow transition. So for this open enrollment, the new vendor will be a secondary support. But come next open enrollment, they will be the primary vendor for OE and onward. Now, this just in general, when you're working with transitioning, there's resources that we have to be aware of, and this is in the mix of OE. So this will be closely watched through our project management process just to make sure that nothing fell to the crack, but it is something that is on the radar and we're actively planning for. And then lastly, we continue to be in PHE. Again, there's approximately 4,000 members and that we wouldn't have to notify when PHE unwinds. And again, we continue to work with DSS to coordinate that transition to make sure that both parties are keeping a high retention of their Husky consumers and the QHP consumers. So since last open enrollment, we've really put our head down to get our system up to date and get bugs fixed. So we've fixed and produced over 155 new features. Some of the notable ones that I want to highlight today, there's the new streamlined and integrated dental process. What this done, it took our dental enrollment from 20 minutes down to 2 minutes. In addition, when our consumers are enrolling through the new process, which integrate dental and medical, they'll actually be able to use our decision support tool. So when they click on dental, they'll be able to see if they already have existing pediatric dental for an individual, covered Connecticut, or any embedded dental within their plan. So we'll actually allow them to see that. And in the event they want to proceed forward, they can, but in the event they did not, we do have that tool there for them. And then also we've updated the covered CT program. As mentioned before, last year, it was just the parent and caretaker that were able to enroll. But with the updated rules, all adults will now be able to qualify for covered CT if they meet the eligibility rule. And then also there's the paper mail consolidation. This has always been a pain point for our consumers. So this year we've consolidated notices into one envelope. So we're foreseeing that about 90% of our consumers would only get one envelope maximum this year. And just overall, this will include the customer experience and definitely will help us save a substantial amount for envelope and postage down the line. And then also we redesigned our account home services to improve self-service. These funding came from the ARPA dollars, and what we're really looking to see this year, one is just improvement in our customer self-service and also our net promoter score to increase. And then lastly, we'll prepare to implement updates to the eligibility rule for the family glitch. So in the event that the proposal is approved, we will be able to pivot quickly and make sure that the spouses and the dependent of individuals who do qualify for their health insurance, they're still able to proceed with their tax credit.
Okay, is that your update?
Yes, that is my update. I'm all done.
Okay.
Thank you.
Are there any questions? If not, I guess we can move on to an update on marketing the new enrollment plan from Carolyn Lee.
Good afternoon again, Caroline Lee Ruette, Director of Marketing. Appreciate your attention here. As you all know, we recently concluded some of our focus groups, right? This is something that we do annually as we start to prepare our creative concepts for the open enrollment marketing and advertising campaign. We want to put these ideas in front of our customers, in front of the uninsured, the underinsured, lots of different groups to get their feedback. That helps us make sure that our messaging is tight and that it's going to resonate. So I wanted to share some high-level learnings from this year's focus groups. You can actually see some photos of that on the left-hand side. They were done virtually just in case anybody had questions about that. We're finding that to be really helpful to get people to actually participate. It's increasing our numbers. So quick note on that. In terms of our learnings, the first is to keep a modest and realistic tone. And this is because most people cannot tolerate overly optimistic messages about health insurance plans. It's a serious topic for folks, and so we just need to be mindful that our messaging needs to strike that tone. Secondly, there's a need to target low and no cost plan marketing. And this is for a couple of reasons. We've heard this over and over again. If folks, hear, hey, there's a free option or a really, really inexpensive option for you, and then they don't qualify, that leaves them with pretty sour grapes. In addition to that, there is a mindset that low cost or no cost is lower quality. We all know that that's not true, and we can do a better job from a marketing perspective to better educate folks, and that's something we need to be mindful of. As well as this third point, inflation. We all know that's a big topic in the news right now. It's really impacting families here in Connecticut, as well as the erosion of benefits and increased costs. That latter portion, right, that erosion of benefits and increased costs is particularly more resonating with the more mature and affluential audiences who had been around for a while. They were used to the HMOs and things like that of the 80s and 90s, right? And so they've seen over time that they get less for their money, and they're being very, very vocal with us about that challenge. And then lastly, there's a need to balance generational differences, including an appetite for messages about policy and policy-related programs. We're talking about things like ARPA, the IRA, Covered Connecticut. The silver lining here, though, folks, is that younger audiences are much more knowledgeable about these phrases and programs than other segments, including knowledge about the healthcare marketplace, about Access Health CT. And so that is something that's a good thing that we've learned, and we're doing a better job with those audiences. They're more familiar with us, which is a really great thing to hear. Okay, we can advance the slide now. All right, and then in terms of what we're doing next, we're currently refining our creative concept based on that feedback. So we're really excited to be able to share our campaign with you in the coming weeks. And as a reminder, that will include information about our new dental experience. We're really excited about that newness this year. And so we're gonna be sure to include information about the dental experience within our campaign. We're also preparing renewal projection notices. As Marlude mentioned, as she walked you through the timeline, that is something that we'll be doing in October, reaching out to consumers and letting them know what their likely renewal rates will be. We're busy developing collateral and content updates for our website, the toolkit, social media, all of our owned media. We're also engaging with brokers, certified application counselors, and community partners through email newsletters, really working closely with Outreach, Tammy and her team, to make sure folks have the information that they need to prepare for open enrollment, especially those folks that help us enroll people. And we're also preparing for launch materials. We're considering a launch tour at our Navigator locations as we've done in the past. And of course, staying tight with Tammy and her team, like I mentioned, and outreach to make sure that we're publicizing information about enrollment locations, our Navigator partners, enrollment fairs, as that information becomes available. So I'll pause there and take any questions.
Hi, this is Cece. I believe you addressed my question about how young people were feeling about Access Health Connecticut. What I would be interested in down the line is how the enrollment pans out after this readiness and the marketing, to see if we do get more young people signing up.
Sure. Absolutely. We can definitely dig into those demographics.
Okay, because that's been a concern, and I do know when I encounter young people, oh, I'm fine, I'll go if something happens. So it would be interesting to see if the outreach is actually getting to them and if they're paying attention. Yeah. Thanks.
Great comment. Thanks, Cece.
So, Cece, at this point, Cece, Connecticut, being one of the lowest, we have one of the lowest uninsured rates in the country at 5.4. The national average is almost twice ours. So the people that are left to enroll are the hardest to get. This is why one of the reasons we created the Health Equity and Outreach Department dedicated, where they will do year-round in-person events, because you have to go into the communities and talk with this population. Because the traditional marketing does not work for them. They get their information from local organizations, barbershops, at the
Right.
church, and so forth. So we have to go there and meet them where they are. Because at the end of the day, our data, if you remember from our health disparities study, people without health insurance live a shorter lifespan than
Right.
those with health insurance. So just that alone is a game changer for a lot of folks, not just with them, but their families, their kids, and grandkids. That get so this is why it's critical that we have to go meet them where they are and make sure they have access to health insurance. And I know you're going to hear from Tammy in a few minutes about the Broker Academy, and the Broker Academy is part of that strategy. So we have knowledgeable people, informed people who will be able to give them the guidance they need, convince them why they need to have health insurance. These are folks from their own communities that look like them, and that understand how to communicate and connect with them on a real personal level. So we're doing what we got to do to keep the ball moving. But this is the hardest population, and I'm happy to say Connecticut is leading the way with respect to coming up with innovative ways to get to that population. With the Broker Academy and other barbershop efforts and going to communities and establishing relationships with other community-based organizations to get this population. And this cuts across all demographics, right? But no, we know there's a disproportionate impact to the communities of color.
Thank you.
Carolyn, are you finished, or is there more slides? No, you're.
Yes, I'm finished, so long as there's no other questions
Okay.
or comments. Thank you.
Okay, well, as James mentioned, let's hear from Tammy next about outreach as part of the readiness plan.
Yes, good afternoon, everyone. Tammy Hendricks, Director of Health Equity and Outreach. Thank you, James, for that great introduction. So, OE is right around the corner for us. We've been planning since really July. We're constantly reevaluating the way we engage with consumers and partners. How can we make more meaningful events? How can we connect more? But most importantly, how can we have more in-person events, right? Which is the core to our outreach efforts. We have protocols in place. 2 years of the pandemic really helped us work through the kinks of holding these events. So we are really happy and prepared this year to start incorporating more in-person events prior to OE even. So, a lot going on this year, covered Connecticut, the IRA, PHE Unwind. So a face-to-face conversation, it's so impactful when layered with all the other marketing efforts that we do. So let's start with a big event, the community conference, or the community summit, we called it last year, name change pending. We did a live virtual event last year, which was very successful, very well attended. But last year, COVID was still, a significant concern for some of our community partners. So virtual worked for us last year. And really, we still had record-breaking attendance. So really successful event. But this year, things opened back up. So we reevaluated how we do the community conference. Ultimately, we came up with a plan of splitting the conference up into 4 events starting in October 11th. We'll have 4 locations in Groton, Hartford, New Haven, Norwalk. And because there are multiple meetings, this allows us to have it in person because it's on a smaller scale, more regional, but a better way for us to connect with our community partners, right? So a lot of course, we'll have a Zoom option as well for those who want to attend virtually, but it's really important for us to have our community partners in a room, have a chance to network and chat with them and just be in person, have those face-to-face conversations. So we'll cover a lot of topics, important OE updates like we usually do. We're working on getting a keynote speaker. So it will be a very busy week for us, but it was really important for us to figure out a safe way of having this event and breaking it up into 4 separate meetings. and spreading the information over, a week span so everyone can digest it was really important for us this year. Then, following the community conference week, we'll host 3 in-person Healthy Chat events for consumers. Again, there will be a Zoom option for those who want to attend virtually. But the plan is to use our new Navigator sites in Willimantic and Danbury, which we know are high need areas. And then we'll host the final presentation at the East Hartford Library, which we had a very close relationship with over OE, doing press events throughout the year. So really solid location that we get a great turnout every time. And all of these events will really take us into OE, right? So this year, the plan is to double the amount of fairs. We've confirmed the East Hartford Library and the Stamford Library for enrollment locations. And we also have 4 Navigator sites ready to offer enrollment assistance as well. So again, the enrollment locations are open Monday through Thursday from around 8 to 4, and this will go throughout OE. But we are still working on locating some venues for the fairs, which are pop-up locations. We do have the dates and the areas that we want based off of data. And usually these fairs are after hours or on a Saturday morning. And we get tons of walk-in, people coming after work or on their Saturday mornings to get enrolled in person. But more to come on that as we work to finalize those. But really, our plan for pre-open enrollment is very robust, and it includes educating community partners and consumers alike. So we're really looking forward to holding a lot more in-person events this year. And I will open it up for any questions before we move on to the Broker Academy. Okay, no questions. Great. So moving on to the Broker Academy updates, we now have 29 students that passed the exam. 1 more is scheduled for next week. So this year we'll have 30 new brokers located in really hard to reach areas that will be ready for open enrollment, which is very exciting for us. We're still working with other students. They need more time to take the exam. And really the state exam was a huge hurdle for a lot of them. A lot of students hadn't been in school for decades or years. So that was something that we're still working with a lot of students on, getting them prepared to actually sit down and take the exam. So our team is making constant phone calls to encourage them to schedule the exam. We have a lot of lessons learned that will make the program much better next year. Next year, after the 3-day class, maybe we will schedule the exam right after they pass the class. So a lot of ideas like that floating around, but we've learned a lot from actually doing the program this year. So for the students who did pass and is ready for the mentorship portion of the program, we do plan on giving them a stipend. And so this is done through grant funding, which we recently got a larger grant from the Connecticut Health Foundation. And this is really a great surprise for them. They were not expecting any, they weren't expecting a stipend. So it was a great surprise when we let them know that that grant did come through and that we would be giving those stipends out at the end of the mentorship. So great news for them. The stipend will be a huge help for them. A lot of them dedicated a lot of time, especially during the in-person class, but also studying over the 2-3 months, and then the mentorship program, which will take up some time as well. Moving on, we have our mentorship agencies. We chose 5 agencies after reviewing the RFP. We wanted to make sure that the brokers were notified about the RFP, so we had many newsletters go out. We even had John make one-on-one phone calls and visits to encourage brokers to apply. So we have 5 great agencies that will get matched up with the students or students will get matched up to the 5 agencies. Legal is working on the contracts as we speak. And our mentorship implementation team, if you remember, we've had a team for each part of the project plan when rolling out the Broker Academy. So now the mentorship team will be checking in with the mentors and the students on a bi-weekly basis, making sure that everything is going smoothly and facilitating any issues along the way. So, you know, of course, we want to learn what went right and what we can work on for next year. So at the end, we plan on having both the brokers and the students complete an evaluation. Really important part of the program is the mentorship. So we want to make sure that we do it right for future years to come. But that's all the updates I had on Broker Academy. James, if you think I missed anything.
I think you captured everything. The only thing,
Drop the
I
mic,
can't really
James.
hear you.
Bring the mic down.
oh, I am sorry. Thank you, Tammy. I think we covered everything that we wanted to get across to the committee. I just want to reemphasize what Tammy said about the student stipend, and that's completely funded by grants. Again, we think we got a total of 3 grants, 2 from Caregiver Health Foundation and 1 from the Fairfield Foundation.
Yep.
And we have applied for more grants that we're waiting for. The possible training fee for the agents, for the mentors. We do understand we are asking them to take on a commitment and to train these new brokers to give them an opportunity to become successful in their own careers or businesses, however they want to move forward. We know this takes time from them, so we do have some grant funding where we will pay them a fee, a stipend, if you will, reimbursing them for their time and skills for training these new brokers. We again fully funded by grants, so that we are not using any assessment money for that. And by the way, when we apply for those grants, we were very specific in those grants, telling that we will take this money and use it for these purposes that we are using it for now.
Mhm.
So, again, Tammy mentioned lessons learned. We're hoping this committee or the board or at whole will be part of that lessons learned as well. We are going to talk with the students, those that took the exam and passed, those who have not taken the exam. We'll talk with our own staff to get their input. Then we also would like to talk with the board as well to get the board's input about what can we do better next year, because we are getting a lot of requests now from community organizations for next year's Broker Academy. Last night, myself, Tammy, John Carbone, and Caroline, we had a forum last night in Bloomfield with Congressman Lawson, talk about the benefit of the Inflation Reduction Act. And we talked about the Broker Academy, we talked about health disparities, we talked about open enrollment, we talked about Cover Connecticut. There was a lot of interest from the audience about getting more information, getting involved with the Broker Academy for next year. And the congressman was beside himself about the Broker Academy.
Excellent. I have a question. In the training, do they concentrate on the individual? Do they concentrate on shop? Do they try to cover both? How does that go?
Is John on? I believe they're gonna do both, but
Yes.
Tammy, do you know that? Yeah, I think they're gonna do both.
Yeah,
But
They do
we'll
everything.
be doing both on and off the exchange training.
Correct.
Yep.
And also, Grant, these are full service agencies. So, and most of the students so far have both the health and life license. So they may be able to do more than just health.
More
And
than just health. Yes.
yes.
Okay.
And if they stay with the agency to become a broker for that agency, they could sell health and life then Medicare Advantage is where the real money is. So
Okay.
it's real money in Medicare Advantage, and so the possibilities for these 30 students is really beyond their imagination at this point.
It's high.
And
Great.
yeah, that's the beauty about this effort. People benefit all around.
Absolutely. Right.
Okay, yes, strategic initiatives. The first item, John, are you going to talk about SHOP?
But we have a quick subsidiary update.
Oh, okay.
Update for you.
Subsidiary. Oh, that's
Yes.
Tony's. Okay.
Yeah, Tony. Yep.
Hi,
Okay.
everyone. I'll be very quick. The business plan for the subsidiary continues to develop. The text is complete. The financials, the financial projections have been reworked a few times and are ready to go. What we have left to do is a name of the subsidiary, which we're having a meeting on that next week. And we need to incorporate into the business plan the staffing, the actual people that would be leading the effort during the startup phase. So those two blocks of information will be coming shortly. And then we should have a finished product for all of you to see at the end of this year. And then, of course, depending upon your comments and input, we will then pass it on to the full board. So really, that is where we are. I'm happy to take any questions on it at this point.
Tony, the only thing I want to add to your completed statement is that we are also working on messaging. This is outside of the business plan. We have to put together a messaging strategy on how do we to message this to the board individually, which I will be doing. Before we bring anything to the board, I will be talking with each board member one-on-one to get their input, get their concerns, and also talking with our carriers. And they have been very supportive of what we are trying to accomplish to the subsidiary, and also talking with elected officials and talking with community-based organizations who would be helpful in getting this, helping us to get this off the ground. Because we are similar to the Broker Academy. Our focus will be on the working poor who do not have access,
correct,
to services. So them, their kids and grandkids get to stay poor. But they don't have access to financial services that would be designed and priced for their needs.
Actually, James, that brings me to a point that I forgot to mention. We've also created customer journeys and the impact that products sold on the subsidiary can alter a customer's lifespan and depending upon the product. We've created slides that show what would be without the product and then how their life is different with the product. So to James's point, it's the most impactful way of getting across the message for the subsidiary and why it needs to exist. Sorry, James, I cut you off.
That's okay. For example, very quickly, this is at a very high level. We do know multi-generous, right? When we are looking, when we first started looking at data to support the strategy for the subsidiary, I think we mentioned this before to this committee. In the last decade, the Connecticut population grew by 10%, by 2%. The number of families that are in the working poor category grew by 40% in the same decade. 40%. So this tells us that the growth is organic. And this is from the Alice data that United Way presents, produces. So the growth is organic, meaning that people in Connecticut are falling deeper into poverty. So every generation is adding to the poverty because they just don't have a way out of poverty. We believe that one of the strategies that I've been playing around with, that I may have shared with some of you, if not, I'll get into more detail as we move forward, is that as we develop the subsidiary and create product and services specifically to help those folks manage the poverty, to stay out of poverty or pull themselves out of poverty, is providing a term life insurance product for anyone who buys one of those other products to the subsidiary. We are looking at providing them a $50,000 term life insurance product free of charge to them. I believe that that term life product would be funded through an annual grant from one of the many foundations that are dedicated to eradicating poverty in the U.S. I started talking about multi-generational level of poverty in households, which is many of the working poor. That's how they are structured. And typically, grandma or grandpa, a child, a grandchild, and grandma or grandpa may be bringing the most money into that household through Social Security, pension, maybe a part-time job. If he or she dies, that family falls apart very quickly. But there's nothing there to support them. So what happens then? That family, the data shows that they fall, within 6 to 12 months, they evicted out of the house or apartment. They either living in a shelter or living with family members. So their lives are disrupted. If we had a $50,000 life insurance to support them while they're going through this shock in their life, that can be very helpful at least maintaining where they are, or maybe even pull them out, propel them out of poverty. With that $50,000 to that grieving family is a lot of money. It would be very helpful. And the beauty about this approach is that they have to buy something in the exchange and the subsidiary. That's going to help them manage where they are with respect to poverty. If something happens to them, they have this net that's going to support them. And I know, and I'm convinced that there are foundations out there who will be more than happy to pay the premium, to cover those folks, because it certainly would help them stay out of poverty. And that's one of the exercises we're doing right now, that if we had this term life insurance available 10 years ago, what would the impact have been with a working poor growth of 40%? Assuming that they bought an item through the subsidiary, and if grandma or grandpa or grand-aunt died, and they had that 50 grand to hold them together, could the growth have been less than 40%? So we think this has really a meaningful impact on the working poor. At the very least, it should help or slow down the growth of the organic growth of poverty in the state of Connecticut, especially if we are going to offer term Medicare Advantage in the subsidiary, and those are seniors, and that's an area we believe is a huge opportunity, because the population we are looking at when they become 65, if they don't have access to somebody to guide them, they would default into traditional Medicare, and that's a very expensive proposition for them. That just covers Part A and Part B, doctors in the hospital and nursing homes. Covers nothing else. Only covers 80% of the cost. So God forbid they get sick, they go to the hospital, heart, or whatever the case may be, $100,000 bill. They got to pay 20 grand out of that, comes out of their pocket. money that they don't have. Whereas Medicare Advantage is more comprehensive, more affordable, but somebody, again, a narrow network because it's a more like an HMO, but that population typically is not mobile. They don't travel much. So that would be a good fit for them, but they get so much more coverage at a much lower, at a same cost or lower than what they're paying now for traditional Medicare. So we think that there's now a huge opportunity to pull people into the subsidiary, and at the same time, they would have access to a $50,000 term life product to protect their family should something happen to them. So again, give you some thoughts about at least where our minds are, and as we move forward with the subsidiary. A lot more to come on that. We're still going through data, we're analyzing data, but part of my job is once we have the business plan all wrapped up and the staffing model is in place, who's going to be doing what, when, where, and how, then I would talk with each board member one-on-one. Just to make sure we're all on the same page before we do anything with the board. I will pause for any questions, comments, or concerns.
Okay, thank you. John, would you like to talk about the IT platforms?
Absolutely. Good afternoon, everybody. John Carbone, Director of Small Group and Product Development. Over the past 6 to 12 months, as you can tell, we've been working on multiple different types of projects, from everything from the Broker Academy to getting ready for open enrollment. Two of the most important things are making sure that we communicate very well and make sure we have the technology to support everything that we have coming in the doors. So over this time period, we started working on the small group platform, which is something that we felt was important. We haven't upgraded it in 5 to 6 years, and we felt like it was extremely necessary to do that for us to continue to move forward. The main reason for updating is basically the broker experience and the employer experience and employee experience. We're looking to make our platforms more self-efficient. We're asking our brokers to basically do more of the new enrollments through the platforms, our employers to make all the new updates, pay bills online, and have employees go in there and be able to use the portal to be able to access member ID numbers, plan information, plan documents that we receive from the carriers, so the platforms can be more self-service. We have released that platform on August 10th of this year. Over the past month, we've been working with a small group of brokers, small group of employers to go through the platform. We are excited and very proud to say that we had minimal disruptions, no disruptions on any type of eligibility, any type of enrollment issues, enrolling new groups, renewing new groups. So we're really excited with that process. We're continuing to work through all the little things on making slight adjustments. As you know, when you roll out a new platform, you always have a vision for something and how it actually gets released. But we're excited to say we're getting some positive feedback. And we're also getting some great constructive criticism on making some slight adjustments on how things need to be seen by a broker and employer. So we're going to stay tuned on that. We'll keep everybody moving forward. But that platform now is officially 100% released, and we're just now tuning it up, fine-tuning it with no risk of any disruption on that. As many of you have kind of also been hearing throughout this presentation, the new integration for the standalone individual dental platform for our consumers. And that's mostly was done because of a customer journey. We had these individuals rolling on to the individual side and then coming over on another platform and rolling into another platform. So that the customer journey was a little disjointed. TOA and a few other departments throughout Access Health. I don't think this project has not touched, I think it's touched every single department here at Access Health. And everybody has kind of worked very diligently on a short turnaround timeline, and we're very proud of what's kind of going to come up. Right now, the customer journey, as Marlu said, will be shortened. So when someone goes to enroll on the individual side and create an account, they're actually going to be able to see all the dental products in the same shopping cart, the same windows, without having to go into another platform. So the customer journey is going to be incredibly improved, and we're hoping that is going to reflect into more individuals looking at a dental plan going in the future. As we've been talking about with the subsidiary and all that, it's a very important product. We feel it definitely will help promote health and will help all around too. So with that one-stop shop for those two products, we're really excited with that. That product is going to be released in our window shopping time. It is being released through the model and other different environments to do all the necessary testing, but to the public, it's going to be released during our window shopping period on 10/24. So we're very happy with that. Last but not least, we're really excited about Chi-Chi, a product from Connecticut. Connecticut will be coming in, Chi-Chi will be coming in with 4 new dental plans, 2 on the individual side and 2 on the small group side. We feel that this basically does round off our product portfolio for these 2 vendors. Now there's a total of 6, if I'm correct, Susan, 6 on the individual side, dental plans, and 4 on the group side, which creates a great balance. We feel like there's enough high-low options and price points for individuals for everybody now. We're going to continue to grow and focus on this and continue to bring in more opportunities here. But we feel that we really focused on making sure that we can bring as many products and shorten the customer journey and make it more simpler for them. So we're really excited what's going to be happening in our open enrollment period. So stay tuned. We'll provide you more information and hopefully in a couple of months. Does anybody have any questions?
Okay. Thank you. Thank you very much, John.
You're welcome. You're welcome.
If there's no other business, I could ask for a motion to adjourn.
So move, CC.
Thank you. Maybe a second?
Paul Lombardo, second.
Okay.
Thank you.
Marcin, can we have a vote? A roll call?
Steve Hernandez, Grant Ritter,
Yes.
Paul Philpott, Paul Lombardo,
Yes.
and CC Woods.
Yes.
Thank you.
Okay. Great meeting. Thank you, everyone.
Thank you all very much.
And,
We'll talk next Thursday. Thank you all very much.
sure enough.
Thank
All right,
you.
everybody.
Bye all.
Bye now.
Bye-bye.